Room 7107 RN. Hi Angie, this is Dr. Mark. Can you talk for a second? Okay, I'm going to see the lady in 7107. Can you join me? Okay, great. I'll meet you at the room in a minute. Thanks. Bye.
Hi, Dr. Marr.
Hey Angie, thanks for coming.
Yeah.
I'm going to see Miss Kingsley. She's a lady with cholangitis and septic shock who's transferring from critical care to medicine today. How's she doing?
Mrs. Kingsley is doing really well. Her pain has much improved. Vital signs have been stable, no more fever. Also, she has an order for to transfer to progressive care, but I was thinking maybe we could look at general care instead.
I'll give that some thought.
Okay.
Anything else?
Yeah, she's still on a clear liquid diet. Gloria, her wife, is here today and is quite concerned that she's eaten next to nothing for several days. Gloria's a really good cook, so she pays particular attention to her diet.
Okay, great. Are you free to go in with me?
Yes.
Okay, all right, thanks.
You as sick as you were.
Okay, bring in the surgeon, I guess, and keep that jello coming.
There's the spirit. I'm going to go over a couple of things with Angie here on the list, if I may. Okay, so on the checklist, S for skin, I didn't see any sign of any skin injury, anything that you've seen, Angie?
No, I think her skin looks really good.
Okay, great. A is for access. We talked about that central line. We're going to get that out. F for Foley, that's coming out too. E for eating and elimination. No problems with diarrhea or constipation, and we hopefully will be getting you to eat later. And for T, we've got a few things. One is tethers. You've still got this monitor on your heart. I think that's been okay. No rhythm problems, so we're going to discontinue that, and of course getting the catheter out and the central line out. Also for therapies, do you think Carol needs any physical therapy or any other therapies?
No, I think Carol's been getting out of bed really well on her own, so I think if anything were to change, I'll let you know, but I think she's okay for now.
Okay, great. Let me know. And for thrombosis, that means clot. We've been giving you this blood thinner with the shot in the abdomen. Once you're up and moving around, walking about 3 times a day, we can stop doing that then. And last part here on the check mark, checking on antibiotics. I'm glad we saw this. I'd forgotten about it. She's been getting IV antibiotics. We can switch those to pills now. And I'll talk to the pharmacist and just make sure we get the dose and the duration right. And then finally, checking on status. You suggested, Angie, that she could go from critical care straight to general care. I agree with you. I think you're right there, too. So general care just means you'll still be in the hospital, but you'll be in a different room, maybe even on a different floor. But I'll still be your doctor today. But okay, Angie, did I forget anything?
No, I think we're good. I'll work on getting central line out today, and then I'll take out your Foley, and I'll work on getting it back to general care. And if you could just please put those orders in that.
Okay. I'll do that, and I'll get in touch with the case manager, let her know maybe a couple of extra days in the hospital before you go home, maybe a couple more.
Okay.
Thank you. Thanks very much. All right.
Thanks. Bye-bye. Is there anything else you guys need before I go?